If you've been diagnosed with cancer, it is really important for you to understand all of the treatment options that are available. So joining us today is Dr. Michael Rutenberg. He's the assistant professor at UF's Department of Radiation Oncology. Thank you so much for being here with us today.
Thank you for having me. It's great to be here.
Today we're going to talk about sarcomas because it's a pretty rare type of cancer. So we want to make sure that people understand what it is and the best treatment options they have, and also maybe how to tell if they have been coming down with it.
Sure. Sarcomas, as you mentioned, are a fairly rare subtype of cancer, so it's not the typical cancer that we all know of, breast cancer or colon cancer. But it still is a really important malignancy to know about and certainly to have effective treatments for. There are about 16,000 that will occur this year in the United States, and it's sort of a broad range of cancer types. So sarcoma is the umbrella term, but ultimately, sarcomas can arise from different types of tissues, bone, fat, muscle, or even nerves. So it's sort of a big name that covers a lot of different types of cancers under the umbrella of sarcoma.
Now, oftentimes people, like say with breast cancer, we've all been taught to do a self-exam and feel a lump and come in. So if you were to develop a sarcoma, how would you even know? What would some of the symptoms that you would develop?
So the most common symptom that brings a patient into their doctor is a painless mass that's growing. So something that wasn't there months or years ago starts to grow, that draws your attention, you go in. But oftentimes they're found incidentally just by, you happen to do a test that shows something and they find a mass. So if people know it's there, it's usually a painless mass. But depending on the extent of the disease and how rapidly it grows, it can cause dysfunction of their limbs, their arms, their legs. That's a possibility. Or sometimes, depending on where it occurs, if it's in the abdomen, it can cause nausea or vomiting or even bowel blockage or obstruction.
So even if you have a lump and it doesn't hurt, you should still get it checked. That's a good warning for folks to check with their doctor on a regular basis.
It's a fair warning. I don't want to be reactive or overreactive, but most lumps or bumps are going to be benign, so people don't need to panic. But certainly if you see something that wasn't there previously and you've never noticed before, and especially if it's growing, you absolutely should bring it to your doctor's attention.
I say that for all the wives out there trying to get their husbands to get in for their checkups. So you come in, you're diagnosed with a sarcoma. What are the next steps?
So one of the most important things about managing sarcomas is to have a multidisciplinary team. So what that means is surgeons are typically involved in managing it, radiation oncologists, and less frequently, but importantly, medical oncologists who do chemotherapy. Mm-hmm. So if you are diagnosed with a sarcoma, a multidisciplinary team at the outset, prior to undergoing any major treatment, is really important.
Now you mentioned kind of muscle and tissue, and those are very vital parts of your body. And you here have the proton therapy, which is so important to treating different types of your bodies that you want to minimize the damage of things like radiation. Can you walk us through how you use proton therapy to treat a sarcoma?
Sure. So let me step back and just sort of describe how protons differ from X-rays, which are conventional radiation. So both are forms of radiation, protons and X-rays, and they both are delivered inside your body to where the tumor is from the outside. The major difference between protons and X-rays is that they stop at the target. So we can control the way we deliver protons, and so the majority of the energy or the majority of the radiation delivered by protons ends up going to the cancer, whereas with X-rays, a lot of the radiation or a lot of the energy delivered by the radiation goes to the normal tissue surrounding the cancer. So you can still treat the cancer, but you're getting a lot more radiation dose to normal tissues.
Which is not a good thing.
That's the reason we have side effects from treatment. So if you can avoid extra radiation to normal tissues, you can avoid some of the side effects of radiation treatment. And
in particular, would you say sarcomas?
Certainly, certain types of sarcomas, protons are really the standard of care and have been for decades. So some types of sarcomas we're really just now exploring the use of protons for, but there are other sarcomas that really protons form the foundation of treatment. And so an example of that is, and something I see a lot of, are spine sarcomas. And you can imagine that treating a cancer along the spine, there's a lot of really important structures around it, normal tissues. So you have the spinal cord, you can have the esophagus, lungs, heart. And so using protons to treat those sorts of malignancies, you can treat the target or the tumor and avoid treating the lung, the heart, the spinal cord.
Well, Dr. Rutenberg, thank you so much for walking us through that. It sounds like it's a complicated diagnosis and as well a complicated treatment, and we appreciate you taking the time to walk us through the process. So, and of course, we'd always like to thank UF Health Proton Therapy Institute for sponsoring this important segment. And for more information, you can visit floridaproton.org or give them a call at 904-588-1436.
Well, coming up, ways to keep our memory sharp. Dr. Alloway explains why the task may be different for men and women. We'll be back.